Presented on this program, Rogers Community Television and all Healthline participants cannot assume responsibility for any false or misleading information. Information presented on Healthline does not substitute for or replace recommendations given by appropriate healthcare professionals. And under all circumstances, personal examination and treatment by medical experts for any health-related conditions must be completed. Information presented on Healthline must be verified with your primary care physician or medical specialist.
Hello and welcome to Healthline. I'm Dr. Colin Elkin, your host, and this is our premiere edition of Healthline for January 22nd, 1999. We're coming to you from the Rogers studio in Brantford, Ontario, viewing across the Rogers region through Kitchener, Waterloo, Guelph, Stratford, and all across our Cable 20 viewing area. With this being the premiere edition of Healthline, we have some great shows lined up for you tonight and over the next few weeks. But tonight we've got a couple of very special guests, some close friends of mine and chiropractors. Tonight's topic for our show is, of course, chiropractic healthcare. So to my immediate right, we have Dr. Kim Pitblado.
Hello.
Hello, Kim. Well, thank you for being with us. Dr. Pitblado practices in Brantford, Ontario, on Brant Ave, 160 Brant Ave in Brantford, Ontario. And my very special guest to Kim's right is Dr. Daryl Daly. And Dr. Daly practices again in Brantford on Charing Cross. Thank you for being with us tonight.
Thanks for having me.
Well, we're going to get started, and throughout the show we're going to be accepting some phone calls, and you're going to see scrolling through the television screen for our local viewers. The telephone number will be 759-7711, and feel free to give us a call and ask some questions to our special guests this evening. Anybody who's calling long distance, you can call us at 1-877-723-7711. So please feel free throughout the hour to give us a shout. Okay, well, Dr. Daly, I'm going to start with you.
Sure.
First of all, now you've been a chiropractor now for about 8 years, is that correct?
That's right. I graduated in 1991.
Very good. And from the school in Toronto?
That's right. Canadian Memorial Chiropractic College.
Very good. And so tell us, for the viewers who haven't been to a chiropractor before, tell us, what is chiropractic? What's it all about?
The basic purpose of chiropractic is to remove nerve interference within the body. The whole tenets or premise behind chiropractic is that we believe that the body's a pretty smart thing, that there's intelligence within the body that's directed through the nervous system, and if we can allow that nervous system within your body to function free of interference, well then that allows the body to regain health, or at least become as healthy as it possibly can be.
Very good. And so how do you do this? Do you use drugs? Do you use surgery?
Right. Good point. Chiropractic is a drugless profession. It's non-invasive and drug-free, and I think right now that's what people want as far as healthcare choices. They're looking for alternatives like that because of the risk of having invasive things and whatnot.
Okay. Dr. Pitblado, who should see a chiropractor?
Absolutely everyone. Everyone has a spine, everyone has a nervous system that should function to its optimal potential. So we're starting with children the day they're born. The minute they're born is wonderful. Seniors and everyone in between. Everyone's spine should function optimally, and therefore their nervous system function optimally. And if it's not, a chiropractor can help them to get back on track with their health.
Okay. Now, you talk about the nervous system. Now, why is the nervous system so important?
The nervous system controls all functions of the body. I guess it would be the computer of the body. All functions are related to input from the brain and a pathway out to wherever that nerve is going. So it's very important that if you want your body to function at the best of its ability, you have to make sure that there's no interference to that connection between brain and wherever that nerve's going. It just allows, your body was intended to be healthy. That's the way it was designed to be. And if we can get it back functioning the way it was designed, free of nerve interference, then it just allows all functions of the body to be as good as they can be.
Okay.
Yeah.
Now we've talked about this word, subluxation. What's a subluxation? Can you explain that?
Go ahead.
Okay. A subluxation basically is nerve interference, I guess in simple terms, but it's where a bone of your spine, there's different ways to explain it, but an easy way is that the bone of a spine loses proper function. It just doesn't move the way it should. In doing that, that creates pressure or interference or a reflex change with the nervous input that's exiting at that level. And if it does that, then that just does not allow the right amount of nerve input to get where it's going. Therefore, the body no longer is in a high state of function. Therefore, health begins to deteriorate.
I see.
So it's a condition in the body where there's not enough energy flowing through it. And that's basically, by definition, what a subluxation is.
Okay. So I always thought that chiropractors worked on backs and worked on spines. Now, why is it so important? And why is it so important when you have a subluxation that the bone not be out of place? I thought it was like a bone thing.
Can I just grab this?
Certainly. You brought your friend along.
This is Henry. We're going to elaborate on what Dr. Daly just said. The brain is housed in the skull. Okay, I don't know how well we can all see this. For those of you, some people, this is really basic stuff. For other people, they've never really seen a spine. So we've got a little plastic guy here to help us out. The brain's housed up top in the skull and protected. And from the brain, you have the brain stem and the spinal cord that comes all the way down right into the bottom of the spine. What's really important, and chiropractors find so important, is that at each and every level in the spine, you have these small nerve rootlets coming out. So if a spinal joint or if the vertebra pair is out of alignment or subluxated, it puts pressure on the nervous system. So the messages coming from the brain cannot get through to the cell, tissue, organ that it needs to get through to.
So where do these are the nerves here? Where do they go to?
They go to every cell, every tissue, and every organ of your body. And that's why some people, although they think it's just about back pain, if, for example, there's pain in your back and you've got spasming in your back, those same nerve rootlets branch into, for example, the bowel, the bladder, the uterus. Imagine what that is doing to that internal tissue if it's doing that to the tissue that you can feel. And that's why it's so important to have the subluxations adjusted long before symptoms are evident.
So one of those nerves goes to your stomach, you're saying? One goes to your kidney?
There's a network, but they do branch off and they come from the spine, and that's why chiropractors, yes, are concerned with the nervous system and your spine, but they work together.
Okay. I've heard you talk about wellness. What's wellness? It's a very chic term in our society today, and a lot of people use it.
Yeah, we use it very freely, don't we? There's foot care places that are called wellness clinics now. Basically, wellness is a state where the whole body is in a state of harmony, or the whole body is functioning to the best of its ability. It's much different from a sick state, obviously, because the sick state is when the body isn't doing that. But wellness is when your whole body is functioning as good as it can be, and you could even take that to every aspect of your life is functioning as good as it can be as well. But that's basically what wellness is, when your whole body is and is functioning at a high level.
So you would say that chiropractic is more wellness care, is that correct?
Yeah, just because Kim brought up a really good point about pain. We often think of, most people think of chiropractic as pain, something, when you're in pain you need to see a chiropractor. We often have a very negative view of pain, but in reality pain is a very good thing for the body, because it's the only way that the body has to tell us that there's a problem. It's not the problem itself. What's causing the pain ultimately becomes the problem, but pain is the body's way of telling us that there is a problem. Why chiropractic is so effective and why chiropractic is a wellness-based profession is because it deals with correcting problems of pain or causes of pain. But more importantly, its whole intent is to remove nerve interference so that the whole body is in a state of optimal function. And if the nervous system is free of interference and the nervous system controls function of the body, then if there's no pressure or subluxations within the spine, then the body's in a high state of wellness.
Okay. So for our viewers at home, if they're sitting there thinking, how do I know if I'm supposed to go to a chiropractor?
Right.
I don't have any pain. I don't need to go.
Right.
Can you answer that one?
Basically, the best thing that anyone can do is to at least get checked. If your spine is subluxated, it should not be, and you're not functioning optimally. Everyone has a genetic code that they've taken on from their parents and their predecessors. That allows you a certain amount of health to function optimally and to be optimally healthy. Your spine can't be subluxated, or the health that you could have, you cannot have if you're subluxated. So everyone should at least get checked. If you are subluxated, your doctor of chiropractic will certainly let you know and explain it all in detail. Another very effective tool we use is a scanning. We were just talking before we got started. A scanning device which actually allows you to see for yourself areas where your nervous system is interfered with, therefore telling us you're subluxated. So that's just one more tool that you can go and have your spine assessed for spinal subluxation by seeing for yourself nerve flow with a thermal scan, it's called, and an EMG scan, a muscle scan.
This is interesting, the scanning device. Now, so somebody can call your office and or call your office and arrange for some sort of a computer scan?
Yes.
Okay.
Yeah.
And so that's going to show my nervous system. And I believe that we do have a clip coming up in the show that talks about the computer scan. And so we're going to see that in a little more detail. Okay, now, basically, how is chiropractic care different than medicine? Like, what do you do different than a medical doctor?
I think the basic difference, strictly other than how we choose to apply our profession, is more in the philosophy behind what we do as a chiropractor. We believe that health comes from within, that the body basically has everything it needs to be healthy. As long as it functions at its best level, then it will express health. We believe you don't have to add anything to the body to create health, or take anything out of the body to create health. On the other hand, I think, in my perception, is that the medical field would want to add something to the body, or possibly cut something out of the body in order to restore health or create health within the body.
So medicine is more of a first aid type of thing? Is that
more of
am
a
I correct in
crisis
saying
care?
that?
We've got the best crisis care system in the world in Ontario here. If you're in a car accident, we have the system for that. If you need a heart transplant, we have the system for that. But it's not a health system. It doesn't create health. Health comes from within. The only way the body truly heals is from inside out. If you continue to have to take things into the body, well, then nothing's changing within the body. So I think that you're absolutely right. Crisis system is more of a medical model. Chiropractic's a holistic, wellness-based healthcare alternative.
Prevent you from getting into that emergency state in the first place.
Hopefully prevent you
is the
from
goal.
having to start that.
So preventative wellness care.
That's
Okay,
right, exactly.
Good. If I was a patient and I was watching the show, how do I decide to first of all, to go to a chiropractor and make the next step? What do I do?
Okay. First thing, like any profession, you want to make sure that you are in the right office. And if you went to a lawyer who you didn't like, it doesn't mean you'd never see a lawyer again. So what I would say to you is do some shopping. You want to make sure, first of all, is that you're not going to, there's a couple different kinds of chiropractors. We would all encourage you to go and see a wellness chiropractor, one who is interested in inside-out healing. That's different from someone who is a back pain chiropractor. So that's the first step. If you phone someone's office, ask if they're wellness-based, ask if they are interested in optimal health of the body, and you can just ask that right on the phone, and you'll know from the response whether that's the office you should be in. Then when you meet the chiropractor, go in and have a consultation. There's no commitment in most offices to just go talk to the doctor, see if there's someone who you feel you can interact well with, and you feel that you understand what they're saying. If you find they're not, there's other offices in town. And in Brantford area, I can say we're really lucky. We have a lot of very talented and good wellness-based chiropractors. So
they could come in and have a consultation with you, and you were talking about that computer scan earlier.
Yes. Yeah.
They could come in and have one of those.
Have that done, and then certainly I'd sit down and explain to them what I'm seeing on their scan and what the next step would be. So, yeah.
Okay, that's wonderful. Now, do I need an x-ray if I was to come to your office?
Now that depends. Certainly there are certain criteria I use, and I do an examination first. And if, for example, there was some symptom like pain referral into the arms, I definitely, or arms or legs or anywhere in the body, pain referral, I do typically take an x-ray there. We deal with children and care for children all the time, and that's where I avoid taking x-rays unless there's some kind of trauma I'm concerned about. So it's all based on what I'm finding in my examination, whether the next step of taking an x-ray is necessary.
I see.
So that depends on the individual.
Okay, interesting. Now, getting back to this scan, this is really intriguing me. I believe that we do have some footage to show our viewers at home about the scan. And so, is this dangerous? Is there
Not at
any
all.
danger behind it?
Completely non-invasive, which is wonderful, and that's what's so nice when we have a expecting mom in the office. Actually, you can see right on the TV set now. The top areas, you can see little areas C1 right up in the top of the neck. Those are bright red, and on the right side you see more bright red.
So what does that red show?
Red show severe nerve root interference. Okay, so those nerves.
So basically that's an area where my nerves are pinched?
Definitely.
Okay.
You also see blue and green.
What could that cause?
Up top in the neck. This is the muscle scan. Now this is the nerve flow to organ scan. The muscle scan, seeing all that nerve flow up top, certainly headache pain, sinus problems, could cause eyesight problems and hearing problems, drainage in the ears, anything like that, okay? And that's when we start talking about children with, or anyone with ear infections. If you look down in this scan, nerve flow to organ, what you're seeing is a lot of, it looks like red from here. This is just them doing the scan. When you see all that red and disruption in the lower part of the spine, you could be thinking that person may not have developed yet, but could develop constipation.
So now somebody is doing the scan here and taking some skin temperatures adjacent to the spine, is that correct?
That's right. And what that tells us is how the nervous system is functioning as it flows out into the organs of the body. Completely non-invasive. It's reading temperature from the skin, which tells us how the nervous system is functioning.
Very good. Very good. Well, that's a really interesting, very high-tech piece of equipment.
Yeah, that's the latest technology. It tells us a lot. That's good.
Excellent. Now, if I went to any chiropractor, would they have that?
Not any, but there's a lot of offices that may use that. And certainly if someone's at another chiropractic office and is thrilled with their chiropractor, you can still get it done at other offices. And chiropractors work together in most cases and would pass on that information to your chiropractor. So it can be accessible to you even if it's not in your office.
Okay. So that usually happens, like if that was my first visit, would I have that done?
Yes, and what I personally like to do with that is after every 12 adjustments, see how the body's responding.
Okay, so you would do another scan after that?
After 12 adjustments.
Okay, now what's an adjustment? You just brought up that.
Okay.
What's that all about?
An adjustment is exactly what a chiropractor does to relieve nervous interference from the spine. It's very low pressure, and it's specific to relieve pressure and restore slight motion, very gentle slight motion, to take pressure off the nervous system.
Okay.
And that's an adjustment.
So basically you're trying to adjust a bone off of a nerve?
That's right, to restore it to the proper position that it was meant to be in the first place.
Okay.
Restore its proper alignment.
Dr. Daly, does that, if I was to come into you for an adjustment, can I just come in once and be fixed?
Well, as a rule, typically by the time, unfortunately, people come into the office, we're usually not the first line of defense as far as back pain, even with back pain. I'd like to get to the point where people are coming to our offices for wellness reasons, but unfortunately, and we need to do a better job as chiropractors, and that's why this show is so great, to educate the public about what we really are all about. Unfortunately, by the time someone comes to a chiropractor, usually the problem's been there for a while. By the time it's been that way for a while, the muscles and the body has the amazing ability to compensate and make some adjustments itself to sort of allow you to function as good as it can till that breaking point when that last straw happens. And then eventually, by the time the person comes to us, there may be chronic muscle spasm or just basically there's a lot of things that have to be dealt with before that function of that vertebral body or bone is to the point where it relieves the pressure on the nerve. So typically, no, one adjustment won't do it. It usually takes 4 to 6 to 8 to 10 weeks to stabilize the initial complaint. Usually, I mean it's different. Everyone's different. There's no textbook that way. But
so people respond at different rates.
People respond at different rates, and but the bottom line is it's not really, it's dependent on how that body heals, how the person heals themselves. There's people heal at different rates and different speeds. Typically, younger people heal faster. So a child, it may take 2 weeks or whatever. But the idea is to reevaluate, 12 visits or down the road to make sure there's been improvement, so that you're doing the right thing. And the bottom line, when the body's ready for it to heal, it'll happen. And unfortunately, that's not necessarily on our time frame. It always happens when the body's ready to deal with it.
I see. Yeah. Okay, now I'm told we have a caller. Bob on line 1. Hello, Bob. Are you there?
Hi. I just got a quick question for you.
Certainly.
Actually, it's nothing to do with like the back pain or anything like that, but I do have something called psoriasis, and they say it can be, related to the nervous system. Would chiropractic help something like that?
Dr. Plato, can you answer that?
It certainly can. The reason I'm saying that is just because, again, we're talking about the nervous system, and if your nervous system is not functioning optimally, your body has to, it's showing you that in perhaps this way with the psoriasis.
For our viewers at home, what is psoriasis, for those who don't know?
It's a skin condition, basically, where you're getting, you can get dry, scaly patches, itchy. Is yours quite itchy, Bob?
Right, yes.
Yeah.
And it's getting quite like worse certain times of the year. I don't know if it's stress or what I'm eating, but I'm told it is probably from stress.
The fact that, I was just going to say, talk about stress. The fact that stress is a factor, when your spine is subluxated, that can be caused by stress in itself, and it's made worse by stress. So it's like a vicious circle, and your body, therefore, this is your body's way of showing you that there's a sign or symptom. So although I can't tell you for sure, yes, that it will clear up, if you're subluxated, you'll be healthier, you'll have lower stress levels, and you may find it never develops because your stress levels would never be that out of control with chiropractic care that your body has to respond this way. So,
right.
yes.
If I were to come in to a chiropractic office, would they be able to do like one once over kind of thing and let me know whether it would help or not?
Yeah, there'd always be a consultation. It's our duty to at least, explain to you what we found and whether we're going to be able to help you or not. And if you have nerve interference, then we'll be able to help you as a chiropractic patient. So yeah, definitely, you'd go through the new patient procedure, whatever that is, depending on the office. And at that point, the chiropractor would be able to tell you whether chiropractic was going to be able to help you or not.
That'd be great. I've tried everything else, like creams and naturopathy and things like that, but I guess maybe I'll try this.
Bob,
Sure.
that would be a good option for you. Talk to either one of our chiropractors here and get in and make an appointment. I'm told we have another caller, Mary, on line 2. Bob, thanks for calling.
Thank you.
Hello, Mary, are you there?
Yes.
Do you have a question for one of our guests this evening?
Yes. Is this covered by OHIP?
That's a great question.
Great question.
Can you go into that, Dr. Daly?
Sure. Partially covered, I guess, would be the correct answer. OHIP, the government funding, we haven't educated the government yet enough about the benefits of chiropractic care. We've still are under the partial coverage. We, at this point, I believe, are still $220 per year per patient in Ontario. That is covered through chiropractic. There is in every office in Brantford, I believe, a surcharge on top of OHIP that basically makes up the total adjustment fee. So if it was $25.65 for an adjustment, $9.65 would be covered with OHIP, and then $16 would be the patient's portion of that.
Okay, so basically when Mary comes into your office, for
Right.
each adjustment she would pay $16.
$16.
And are there different rates for children, seniors?
There's always a different rate for seniors, for students. Yeah, there's differences that way.
And is every office the same?
As a rule, no. Within probably a few dollars, yes. But I think it's more regional. To go to Toronto would be a little bit more money for some reason. But basically, around in Brantford, I think the offices are pretty close to the same fee.
For lack of confusion, though, too, for Mary, the OHIP portion's always the same. That doesn't alter
That's
from
right.
office to office.
That's
it's
right,
just
sorry.
the added fee on top. It's easier for me to do that when I'm sitting back listening,
Yeah,
right?
yeah.
I'm interested in the senior's fee.
Okay. Typically, I think if it was $16 for a regular adult, it would be half that for in our office. And I think it's probably typical in the rest of the offices in our area as well.
Between $8 and $10.
8 and 10,
probably.
something like that. Yeah.
Okay.
Okay,
Does
then,
that answer
thanks
your
very
question?
much.
Thank you for calling, Mary. Well, some good questions.
Government funding.
I was interested in Bob's question about
was gonna say
psoriasis. Now, psoriasis is a pretty nasty condition and can cause a lot of skin patches, but aren't there other associated conditions that can affect psoriasis, like arthritis?
Yeah.
Yeah. I think the interesting thing about his question was he knew that it was a nerve-related condition. And, we don't, I think as chiropractors, again, we've been really naive or bad at educating the public about what we do. I would think that since chiropractors deal with nerve interference, that he might have chosen us as the first choice rather than one of the last choices. And but it's interesting. We're just beginning to understand how diverse and how extensive the nervous system is. And So it's nice to see that people are understanding that, and he realizes that it's a nerve condition, and maybe chiropractic is one of the answers.
You're right too. For Bob, psoriatic arthritis is another kind. It's another part of that whole syndrome with psoriasis, and certainly it keys in on areas such as the pelvis and the lower back. And it doesn't mean that, Bob, you have lower back pain now, but certainly it's a good idea to get it checked to make sure that that's not something developing for you. One other thing I was going to say to Bob, because you were talking about creams and the like, so I was just going to use an example, and I always find this fun dealing with patients. If you take an elastic and put it on that nerve root and leave it like that. Okay, I'm going to do this for a second. This finger can start turning red and irritated. Now, I could rub cream on that all I wanted, but what we have to do to correct the problem is take the pressure off the nerve root, and therefore not only the skin but all the joints and organs would be functioning properly. So if you're someone who is doing creams and lotions and ultrasound and all of this carrying on, check the base of it. Have your nervous system checked, because you could stretch all you wanted, but if the nervous system's interfered with, you're not going to get there.
That's a great analogy.
That's perfect. Yeah.
Now, I've heard things in the past about chiropractors who claim they can cure everything, but this sheds light on that comment in the fact that you're not, if I'm reading this right, you're not necessarily trying to cure a specific condition as much as you're trying to make the body more efficient to take care of itself?
That's right.
Is that correct?
I don't think chiropractors, any doctor cures anything. We don't treat arthritis, or we remove interference to the body's own ability to do that, because that's the only way that the body truly heals. And that's why, can someone with cancer be helped with chiropractic? Well, yes, they can. Will it cure the cancer? No. Will the body have a better chance to? Probably. Chiropractic isn't about curing anything. It's about removing interference, allowing the body to function at the best of its ability. And if it does that, then some amazing things can happen because of that.
That's wonderful. Well, we're getting ready to go for our break, but keep in mind this is a call-in show, and please feel free to give our guests a call, ask them some questions. They're at your disposal. I'll go over the numbers for you. The local number in Brantford is 759-7711, or across the region, 1-877-723-7711.